How quickly does DLBCL progress?
DLBCL is an aggressive cancer, and so it often will grow very rapidly, and that means usually in days or in weeks, patients will become symptomatic and will need therapy relatively soon. This is not a disease where watch and wait or observation would be considered. If the patient has disease with an aggressive lymphoma, they need to have treatment started in the very near future.
So lymphomas can be broadly, again, when you think of any disease, you can think of something called aggressive progressors and more like a slow indolent type of lymphoma. Diffuse large B-cell lymphoma comes under the more aggressive version of lymphomas. But again, it's a spectrum of disease. Not every person is the same. But on an average, most people present with, they were fine maybe a couple of months ago, suddenly start feeling fatigued or having fevers and weight loss, and then start getting lumps in the form of lymph nodes that are enlarged in different parts of their body. So it is usually, in general, it's slightly a faster progressive disease compared to a related disease, for example, which we consider maybe follicular lymphoma. So that's more of a slow progressive disease, and many people are detected incidentally. With diffuse large B-cell lymphoma, usually patients are more symptomatic and they present to the doctor with some complaints, and that lead to the diagnosis.
It's an aggressive disease, so it progresses relatively fast. Some patients it may have a more indolent disease, a more indolent lymphoma called follicular lymphoma that eventually transforms and becomes an aggressive lymphoma like DLBCL.
Majority of the diffuse large B-cell lymphoma patients do notice enlargement in the lymph nodes when their disease progresses, but in some of them, those nodes could be internal, so they may not feel the growth. A fraction of patients will experience something that we call B symptoms. It's fevers, chills, night sweats, extremes of fatigue, not having much energy. Those could be the early signs of a disease progression, in addition to enlargement in the lymph nodes. And depending on the site of the involved site, they can present with unexplainable pain. For example, they have a mass in their abdomen and they may end up having a severe abdominal pain. Or if they have a mass in their brain, they can present with confusion, seizures. So progression can present like anything, honestly.